Hey baby, welcome in. Nice to see you. How you doing? Oh, not too good. Yeah, I guess that's why you're at urgent care. Well, I'm glad you came to me. Oh, you tried to go to the ER? Oh yeah, I bet that weren't too fun, was it? Yeah, it's like impossible to get into the ER. It just it doesn't really work, it doesn't work out. So, let's go ahead and just get some diagnostic, stuff done, and then we'll start talking about what brought you in, okay? Okay. Alright, so I have a nice handy dandy notebook, and have all my preliminary things written down for you. And yeah, I'm just gonna ask you, just a few questions, and then we'll move on, okay? Alright, let me just make sure I got your name correct. Just want to make sure that I spelled it right. Alright, and what about your pronouns? Perfect. Alright, and your date of birth? Pretty sure one of my cousins was born on that day. How nice. Okay. What about like your social, your visa, or something? Perfect. Okay, and what's a good contact? Email, number, whatever the best way is to contact you. Okay. Perfect. Alright, and why don't you let me know your address? Awesome. Okay, and next we'll move on into just, some preliminary questions, just so I can best, serve you and help kind of figure out what exactly is going on, okay? These are just some things that are good to know beforehand. It's stuff we ask everybody, Do you drink alcohol? If so, about how many times per week do you drink alcohol, sweetie? Okay. Alrighty. What about tobacco? Do you smoke any tobacco products? Alrighty. And what about other substances? Maybe, any other like recreational substances? Okay. Perfect. Okay, we're gonna move on into like your health profile. I know these questions can be, kind of invasive, but really we're just trying to kind of just get a feel about what your overall health is like, and that may be affecting what's going on. But if you don't feel comfortable with these questions, we can just skip right over them. So don't feel pressured to answer anything, okay? Okay. So, how much water do you drink typically, in a week? Okay. And describe your diet. Like, just your typical diet in a week. And look, I know talking about your diet to a doctor is like, has all this bad stigma and stuff, but girl, don't feel that way. Like, literally, just be honest. It's fine. There's nothing shameful about what you eat or don't eat. Just tell me. Okay? What about, on the weekends? If you're working, that makes sense. Listen, it's really hard, like, the expectation to eat healthy all the time, like, of course, like, it would be nice if we all had the privilege to be able to eat healthy all the time, but we don't. And I think considering everything that you're going through and your life history, you're doing a good job. Yeah, your occupation? Do you have a job? Nice. I've always kind of been curious about that field. Yeah, that's cool. Really cool. Nice. And where is your location of work? Like, do you know that address? Street, okay. What's that zip code? Okay. Perfect. Okay, and what's a good, emergency contact for you, sweetheart? Yeah? And what's their relation to you? Perfect. Okay. And, if I write you any, prescriptions, which I very well may be today, I'm a doctor. I write prescriptions. It's just something I do. Where can I send that? Okay. And that's the one. Yeah, exactly. Okay. Perfect. Awesome. Alrighty. So now we're just gonna move on to just some more preliminary measurements and things. Oh, well, there's actually a few more questions here on the back. I totally forgot. Have you had any surgeries recently, especially any major surgeries? Okay. Oh yeah, that was probably my last major surgery was when, like, I got my tonsils taken out too. Awesome. Okay. Have you had any medical issues recently, you want to talk with me about? Mm-hmm. Oh, okay. Huh, okay. Yeah, huh, okay. That's good to know. Thank you for sharing that. Okay. Okay, well, we definitely will keep that in mind as I evaluate you. Okay, so we are going to be taking your weight. I don't know why exactly it is just a requirement that we do this, but it's just something we just like to keep on record, just in case there's ever like a dramatic drop in weight, or dramatic addition in weight. It's just a good thing to know, but please do not feel any pressure about this. I do ask that my patients, face me as they are weighing. So the scale's over there, so we're gonna have you step over there, and basically you just face me and don't look at the scale itself. And my nurse assistant, she's gonna make sure you get weighed and everything good. Yeah, and then she'll record that number in our system. Yeah, so don't feel like you gotta look at it. It's really not that important. It's kind of dumb that we do it anyways. Like it's not like a major measure of health, but I don't know. It's just something we do. Anyways, just in case. So don't worry about it. So just face me. Okay. Okay. You're doing a great job. Yeah. And just make sure, take your shoes off, right? Yeah. You don't want to be taking, perfect. Alright, you can go on back. Okay. Welcome back to the seat. Okay. So my lovely assistant, recorded that measurement for me, so you don't even have to worry about seeing that. And, you're also going to go on this other side of the room over here, and we have a blood pressure cuff in like an automatic one, over there, so I don't have to actually give you the blood pressure. Yeah, whatever's less work for me. But my lovely assistant will make sure that you do it correctly. So you can go over to that side of the room and get your blood pressure measurement, and she will record that for me. And in the meantime, while you're doing that, I'm just gonna do a little bit of writing up. Okay, are you done? Perfect. Okay, so let's see where she has recorded those measurements. Looks like your blood pressure is normal. So that's good. So why don't you tell me a little bit more about why you came in today? Finally getting to the good stuff. Oh, so you said your throat was like it was swelling, okay? Okay, we definitely want to take a look at that. When did that start happening? Has that been recent? Oh, so you decided to come to urgent care because you've been really anxious about it, and so it happens kind of randomly. Yeah, so your throat just kind of has this almost swelling feeling, like you can't breathe. Is there like any burning associated with that by any chance? Oh, okay, yeah. So it does burn a little bit, but it goes away. So it's not like a constant swelling type of feeling. Is it more of a feeling, or do you really think your throat is swelling? Huh. That's interesting to note. Okay. Here's another question. Does this often happen after eating? What about after sleeping? Like when you wake up in the morning, when you lay down at night? So is it like a burning / swelling sensation? Okay, yeah, okay, that's good to know. Okay. Great. Okay, so we come in, basically, if I'm just want to make sure I understand you correctly. So you basically came in because you're feeling some anxiety about your throat and your esophagus. It's burning and it almost gives you the swelling feeling like you can't breathe. You're not sure why that's happening. And it's not all the time, so it goes away. But it's scaring you enough and making you anxious enough you feel like you need help. And today you kind of had a bad episode with it. Yeah, I totally understand that anxiety. I had something similar happen to myself, and I think I might know what it is just by you talking to me. But we are going to take a look at your throat. So, what you're going to want to do is, I'm just going to ask you, just going to kind of hold your face, and I just want you just to open and go, as much as you can. And I am going to take a nice look in your throat and see what I can see. I'm gonna have my assistant shine a light there. Okay, so okay. Yeah, do you see that? Yeah, you see that too. So okay, let's see. Okay, all right, so you can, yeah. Okay, all right, so I can tell you it does look like your throat is inflamed, so you definitely are not making that up. Your throat is I'm seeing some redness and swelling in your esophagus. That is what I think is indicative, based off of you telling me that it happens after you eat, of probably something called acid reflux or even possibly GERD. Has anyone ever explained to you the difference between acid reflux and GERD? No? Okay. Well, acid reflux is a pretty average, normal thing. You can get it and you may not even notice it. Essentially, it's just the acid in our stomach that's meant to break down our food. Sometimes the valve that, is supposed to allow the food from our esophagus, the food into our stomach that gets to our stomach acid, sometimes the valve does not close completely off like it's supposed to. Yeah, it's supposed to close, like it lets food in and it closes, so then the acid doesn't get up to your esophagus. Your stomach lining is meant to hold all that acid, but your esophagus just is not structured to be able to take the acidity. So what happens is sometimes that valve just doesn't close all the way. Some people just don't have well-functioning valves and it just doesn't close correctly at all for them, and that would be more so of a GERD situation. So GERD is an acronym for a gastrointestinal reflux disease. So essentially, their, internal valve just doesn't close or like doesn't close properly, hardly ever. So they just kind of have a constant acid issue. Honestly, we would have to run a little bit more diagnostics on you in order to really be able to tell if it's GERD or if it's just a bad case of acid reflux. No, don't feel bad about it. Look, like, because it does look like you have quite a bit of redness and swelling, it looks like you did get quite a bit of acid up your esophagus, and maybe if you've been laying down on it, it's been traveling up your throat and really irritating you. And probably the irritation in your throat, because it's not like you have a cold, right? You don't really know what's going on. So you're probably like, oh my gosh, like, what's wrong with me? And then you're freaking out. Yeah. And the anxiety just makes things worse. So of course, ultimately, the best advice is to always stay calm. Yeah, stay calm. I know. Much easier said than done, right? Yeah, I know. But staying calm is always going to be your first thing you want to do. Secondly, it may be also beneficial for you. Think about some things that are going to reduce your anxiety. Anxiety and feeling anxious about it. It's almost like your brain's telling you that your throat's closing or that something's wrong with you, and that just kind of makes the burning sensation and everything worse, even if it isn't really, Yeah, so just, I can give you some paperwork that we have. Let me give myself a note of that. If not, I can send it to you in our patient portal. Yeah, but essentially I can send you some different coping skills and coping mechanisms and programs that we have here that help our patients who deal with anxiety kind of learn how to decompress those in natural ways. Another thing I can do is I can provide you some medication. I know for myself, like I said, I have struggled with GERD for all of my life. Unfortunately, I had a doctor who just basically told me that it was my weight and just shoved me off and didn't even look at my throat, and now my throat is permanently damaged from it. So, I know. Oh, no, it's not just weight. There's lots of things that can cause GERD. Sometimes it's just genetic ways you're built. Sometimes it's just over time things change. But yeah, there's lots and lots of reasons why someone could have GERD or acid reflux. Also, yes, what you eat can definitely affect it. If you eat very acidic foods, really greasy foods, I would just say, try to limit those if you can, but, they're not the ultimate all reasons. Millions and millions of Americans have GERD. It's definitely not just fat people that have GERD. For some reason, lots of doctors think that, but no. Lots of different people have GERD, and that's totally normal. Depends on so many factors, and it's not just one individual thing, it's lots of things that can, make up how our body functions and what things work and what things don't work as well. But things like, for example, you could have a vegetarian or a vegan who eats like a crap ton of oranges and citrusy fruits all the time. Well, citrusy fruits are extremely acidic, and something I'd probably recommend now that you try to steer clear from as much as possible, or just limit it as much as you can. Or if you know you're going to be enjoying some citrusy fruits, I would probably keep in stock in your pantry a good magnesium-based acid, reliever. Yes, magnesium-based. I had a terrible episode myself, because luckily I'm a doctor who went through the same thing as you are right now. Where I basically had a really bad GERD episode, and I felt the same thing you are, with like, a burning throat, and I'm anxious, and yeah, and essentially, I ate so many Tums, because Tums are calcium based, which it works great as an antacid, right? But what does too much calcium cause? You don't want to have way too much calcium, because that will give you kidney stones and kidney issues, which is very prevalent in my family. Not not sure about yours. Do you have kidney issues? Kidney issues in your family? Yeah, okay. So yeah, you definitely want to stay away from the Tums. But luckily magnesium is also a really great ingredient that is great for antacid, purposes, and has totally transformed my journey with acid reflux. So, and really I didn't adjust my diet that much. I just, if I have one very acidic, like if I have a plate of spaghetti, for example, tomatoes are very acidic. So later for, supper that night, I might try to have something less acidic if I can. Try to limit the sodas if I can too. I find sodas and carbonated drinks just get things stirring, but you do whatever's comfortable for you, and if for some reason you do enjoy those things, just keep a good antacid on hand so then it doesn't make your throat do that, okay? Okay. But I'm not really recommending any specific diet or weight loss. Like, I don't really believe in that. You eat whatever is accessible to you and what you want to eat. And whatever is best for you and your body, I want you to do. And I will accommodate and work with you. Yeah, that's what I believe my job is as a doctor. So, I can write you a prescription for something that should help with the redness and some of the swelling that you're experiencing in your esophagus. So I will put that in with your pharmacy. Perfect. Okay. Great. Assistant? Yeah, my lovely assistant. Can you go grab her a little sample of? Yeah, perfect. Okay. Yeah, she's gonna go get you just a little sample so you can go ahead and take it while you're here. Yeah, just to relieve that pain. Yeah, I know, that's not fun. Trust me, girl. I know. Okay. So essentially you're gonna want to take, it's basically gonna be a liquid medicine, and I will go ahead and warn you, it's not going to taste good. I wish I could make it taste better, honey, but I can't. I can't. It's bad. But you basically just kind of gargle it around your throat and then swallow it. I know. Kind of like mouthwash in a way. It's just going to kind of help coat your throat and your esophagus a little bit and kind of help calm down your swelling and redness. Yeah. And of course, like I said, try to reduce some of your acidic foods in your diet if you can. Like I said, if you are going to be eating acidic foods, maybe you just, after you eat them, find you a magnesium-based antacid. You can get that at the grocery store, and take that afterward, right? Based on what's recommended on the back of the package, okay? Yeah, okay. Alrighty. Alright. Okay, so your prescription was just finalized, and you should be able to pick that up with the doctor, not the doctor, the pharmacist, in just a little bit. Probably by the time you drive from here, you should be totally fine. Yeah. And great, just finishing up some final notes on your account. No, thank you. Listen, you've been a great patient. I want you just to take a deep breath. You're totally fine. That medicine that I prescribed you should help with your throat. Just know you're okay. Your blood pressure's good. All your vitals look good. You're good to go, girl, okay? Just chill out, okay? Yeah, and I'm going to give you my personal contact information that I will put in our client portal, which you can access online. Just in case, you have any more flare-ups or you have any more questions about things. Oh yeah, the directions for the medication will be on the bottle. But essentially, just every morning and night, you're going to want to do that kind of gargling with that liquid medication. Yeah, I know it's not going to be very fun, but it will help your throat, though. It just doesn't taste very good, sorry. Just go have you a nice, flavored drink afterwards, Just maybe one that's not so acidic. Perfect. Okay, is there anything else I can do for you? No? Okay, thank you so much for visiting the urgent care. My assistant will lead you right out